Hello guys, welcome to my channel once again, where we make videos that cover all you need to know about medical doctors and medical students. If you're new to this channel, please subscribe and turn on the notifications so you don't miss my new videos every Saturdays. And to my returning subscribers, thank you very much. I really appreciate you. We're growing and I really am grateful to you. Welcome to the second episode of Questions Doctors Will Love You to Ask Them series. And in today's video, we're going to talk about questions doctors will love you to ask them concerning your drugs. Now let's dive into today's video. Let's define a drug. A drug is a chemical substance that, when taken by an organism or an individual in this case, causes a change, a biological change in the body with the aim of producing a desired outcome. So we usually prescribe drugs based on three broad reasons. The first is to cure a disease. The second, for incurable diseases, is to prevent the diseases from getting worse or to make the individual feel better. And the third reason will be to prevent an individual from contracting a disease. That means there's the curative reason, the palliative reason, and the preventive reason. There are questions you need to ask concerning your drug prescription, because with the knowledge you gain from the answers, it helps compliance. And better compliance means better health outcome for us, which makes both the doctor and the patients happy. And doctor, how old are you now? The first question you need to ask your doctor about your prescriptions or your drugs will be, what is the name of this drug, or what are the names of these drugs you're prescribing? This is very important so as to be able to identify them. Understand that drugs usually have three names: the chemical name, which is based on the active chemical substance the drug is made up of; the generic name or the non-proprietary name, which is also based on the actual chemical structure that the drug is being made from, but then being named in a unique way, on a very simple way that you'll be able to understand it. And the World Health Organization usually provides the name, the list for the non-proprietary or generic names, whereas a lot of countries have bodies that also regulate that give the list for the generic or non-proprietary name. Then the third name will be the brand name. This is the name given by the company that produces the drug. So a lot of companies own patency or own the right to produce drugs, and they name them. Now you're a bit confused. Let me give an example to help this sink in. There's a drug called N-acetyl P-aminophenol. That is the chemical name. You know its generic name as paracetamol or acetaminophen. And the brand name, depending on the companies that make them, it could be Panadol, it could be Tylenol, it could be Pandrex, it could be Adol. The list is so long. Doctors usually prescribe drugs by their generic or non-proprietary names, so you would understand what we're prescribing. If in the case a doctor prescribes a drug by its brand name, which is usually not right, it means, for example, in Africa now, I might prescribe a particular brand for you because we know the brand works. There are a lot of substandard drugs being circulated out there, and you might get the drug with the name, but then it doesn't serve the purpose. So usually a doctor will prescribe based on the brand because he or she trusts the efficacy or trusts the quality of the drug. But ideally we prescribe based on the generic or the non-proprietary name. So you need to ask for the name of the drug. It's for you to identify the drug. It's easy. It doesn't hurt to know what drugs you're taking. After the prescription has been dispensed, you can bring it back to us, or you can ask the pharmacist, okay, what's this blue pill? What's its name? What's this red pill? Its name. And it helps you to identify them. It's easy. In case you happen to be somewhere that your drug history cannot be assessed and you need medications, you can just say the name of the drug, and this will make things easier. And you also will want to know the name of the drugs or the names of the drugs, so that in case you have any known drug allergy, you can be able to easily identify which drug is not meant for you, and you let the doctor know so that he changes it or she changes the drug for you. Another reason you need to know the name of your drugs is know it. It adds to your knowledge. Isn't it cool when you're able to call some drugs like that and you're not a health personnel? The next question you will ask your doctor will be, what is the function of this drug you're prescribing, or what are the functions of these drugs you're prescribing? When a doctor prescribes one or more drugs for you, he would explain why he's using that number. The ethics is that you use the minimal number of drugs as much as possible. So we don't like polypharmacy. We want to ensure that you take as little quantity of drugs as possible. If it is one drug, maybe the drug is for just one disease entity, and that one drug alone could serve the purpose. Sometimes it might be one disease entity and we'll need to add more than one drug so that it helps the efficacy of the one drug itself. Then sometimes again, you might have more than one disease condition and we'll give more than one drug to be able to tackle that. But we usually ensure that we don't give you, or we don't load you with too much drugs, as plenty drugs usually makes it burdensome for the patient, and that affects compliance. The functions will also help you to know whether you must take the drugs or not. Usually we'll prescribe drugs that you must take. We don't prescribe unnecessary drugs for you. And when a doctor prescribes, you must take the drug ideally. But it will help you to be able to obey or comply based on adequate knowledge itself. So while you're asking for the function, also ask if you must take the drug. It goes hand in hand. The next question you want to ask is how much the drugs cost. How much do these drugs cost, or how much does this drug cost? It helps you to make better financial decisions. If you're insured, you want to know what type of coverage the insurance company has for this drug. If it's fully insured, if it's partially insured, or it's not insured at all. Financial status is extremely important to us because there are drugs that you might have to take for a long time, and we don't want that in the course of taking the drug, in the course of compliance, you just go broke. So sustainability is very important for us, and we want that we prescribe drugs that you can be able to afford. If you see us prescribing expensive drugs for you, it is necessary and there are no cheaper alternatives. But then you can discuss with us. The next question you should ask your doctor will be, how do I take this drug? And that will cover the route, whether you're taking it orally or through any other means. The dosage, could it be 2 milligram, 5 milligram? Drugs usually come in their dosages. And then the frequency, whether you're taking it once a day, twice a day, thrice a day, or 4 times a day, will tell you how you take it, the frequency. And then the duration, that means for how long you're going to take it. Is it for a day? Is it for 5 days? Is it for a week? Is it for 2 weeks? Is it for a month? Is it for a lifetime? We'll let you know the duration. But then usually drugs that you take for a long time, we encourage that you come for follow-up so that we'll see how you're improving and modify these drugs for you. It's very important you know from the beginning when these drugs are being prescribed to you, and it helps with compliance too. The next question you want to ask your doctor will be, what will happen if I miss a dosage of this drug? I am saying this not to encourage you to miss your dosage. I beg you, take your drugs as prescribed by your doctor. But then some drugs have serious implications when you miss just a dose of it, while some do not have serious implications. For people that have busy schedules or whatever will make you likely to miss a dose, you want to discuss with your health practitioner while he prescribes or while she prescribes this drug for you, so as to know that you don't skip it. Please don't go and skip it on your own. Tomorrow you say, I forgot, or I was too busy. No, discuss that. There are some particular drugs that if you miss just a dose, you have to start all over again. While there are some that if you miss a dose, you can just continue and which wouldn't have any serious implication. Please, for those that you know you have the habit of missing dosages, also discuss with your health practitioner. And these skipping dosages, especially when it comes to antibiotics, has increased resistance on its own. Some people just feel better and stop taking their drugs or reduce the dosage, reduce the frequency of taking the drugs. Please don't. Discuss with your health practitioner and he or she will let you know how important it is to comply with everything. Please, every drug is important. You have to comply with them. But then you can ask that if you have a habit or you have schedules that might make you do that, so that you plan adequately to take them. If you need to set reminders, if you need to talk with somebody to help you, you do that. The next question you want to ask your doctor is, what is the side effect or what are the side effects of these drugs that you're prescribing? It's very important. We had defined a drug earlier as a chemical substance that causes biologic effects in your body. This is to tackle a disease that an individual has. So sometimes, again, drugs usually have, in fact, most drugs have side effects. Some are acceptable, some are not acceptable. So you want to know which one is acceptable and which one you should be concerned and immediately seek the help of your medical doctor. Please don't stop drugs on your own. Discuss with your doctor, and if there's an undesired side effect, come to the hospital or call to be able to discuss properly on what is expected. So it's very important that at the beginning you know what side effect is okay and what side effect is not okay, and will warrant whether you stop the drug or not. And please don't stop and stay at home. Try as much as possible to access the hospital and report side effects, and we'll be able to tackle them, maybe arrest the undesired effects and also change the drugs for you. Some will just suffer in silence while taking it and just endure. No, it's not right. As much as possible, we want to make sure that you're very comfortable taking your drugs, and whichever inconvenience the drug will cause will be something that is bearable. If it's unbearable, then it's a problem to all of us, because again, it affects compliance. The next question you want to ask your doctor will be, is there anything I should avoid or I should do while taking these drugs? It's very important. We know that, especially for oral drugs, they are taken in relation to meals. So you want to know when you should take them. Is it before, during, or after meals? And there's some certain lifestyle that affect drugs, especially alcohol. So we wouldn't advise you take the drugs with alcohol or immediately after taking alcohol. And then maybe there are some drugs that have sedative effects, and we'll advise you to take them more at night instead of in the early mornings, so that it doesn't affect your productivity. Some drugs like diuretics too will make you go to the bathroom to urinate a lot of times, and that would affect your sleep. So depending on your schedule, we wouldn't want that your sleep is being interrupted. So you want to ask this question: what should I do? What shouldn't I do while I'm taking these drugs? So that the best health outcome is being achieved by you taking the drug itself. Ask the doctor. Let he or her know about your lifestyle and which lifestyle is appropriate for the drug or isn't. Ask. Please don't assume. Don't go and search. Don't go and discuss with friends. You have your doctor. It's part of his or her job to ensure that all this information is being given to you. The last question you want to ask your doctor concerning your drugs will be, how do I prepare these drugs and how do I store them? Okay, for the preparation of the drugs, these are usually drugs that are not pills. Pills you just swallow, that's all. Some come in powdered form, so you want to know how to reconstitute them, what volume of water to put. And some drugs, when you reconstitute them, you just use them one time and you discard. Some you use them for a few hours and discard. For some you use them for a maximum of 24 hours and discard. It's extremely important you know how to prepare them and when to discard them. Another thing you want to know is how to store them. Some drugs are okay at room temperature, just keep them at home, there's no problem. For others, you need to refrigerate and store at particular temperatures, or else they get destroyed or damaged and they don't serve their purposes. So that you don't use damaged drugs, and that wouldn't serve its purpose at all. So that's all for the questions you need to ask your doctor concerning your drugs. Is there anything I've missed? Is there anything you're not comfortable with? Please comment and I'll respond to you as soon as possible. What do you think about the video? Please don't forget to like, don't forget to subscribe, and don't forget to turn on the bell notification. Thank you.